And you're sitting here listening to the Dental Student Vibes podcast. Today we have an awesome interview for you today. We have the happy couple, Dr. O and Dr. Min. These two have met in dental school. They love each other. They love dentistry. What more can you ask for? So tune in and enjoy this great interview. Make sure you guys follow us on Instagram at dental.student.vibes. And as always, just give us a like, comment, review, and we'd love to hear your feedback. Hope you guys enjoy this one.
Another episode of the Dental Student Vibes podcast. Today, we have two very special guests, Dr. Linda O and Dr. Casey Min, who are both graduates of the University of Detroit Mercy Dental School, class of 2018. I'm here today with Cole Herzik, and my name is Seth Kalish. So Dr. O was born and raised in Virginia, and Dr. Min was an international student from South Korea. Their dream of becoming dentists brought them to Detroit, Michigan. After dating the first 3 years of dental school, they got married and endured the final year together as husband and wife. They are currently working in the same dental practice, and they would like to share their experience of dental school and the transition to real-world dentistry.
In today's episode, Doctors O and Min will take us back into how they maintained and still maintain balance between life outside and inside the office, as well as the pros and cons of being a dentist couple.
All right. So Dr. O, Dr. Min, how are you guys today?
We are doing great. How are you guys?
Awesome. You know, it's kind of tough being quarantined, spending time in the house, watching Zoom lecture after Zoom lecture in dental school. But, so how are you guys doing with regard to COVID-19?
Just like you guys, we stay at home, and the state of Virginia, the governor ordered to stay home until mid-June. So we just stay home. Our office is still open. We are just seeing a patient for emergency treatment only.
Yeah, we have a couple of senior doctors just rotating through our offices for emergency treatment, and then the rest of the associate dentists we're home. And right now in Virginia, it looks like maybe end of April. We're hoping for some good news and to start to get back into the office, hopefully in the beginning of May. But just like everyone else, we're trying to be productive. We're playing some Nintendo Switch over here. Animal Crossing is one of my new favorite games. And we're doing some CEs here and there. And we're just trying to rest up. And just like everyone, hoping for the best, hoping for some good news soon.
Right.
That's awesome. That's great that you're finding that nice balance between still working, seeing some emergencies, which is awesome, but then, you're definitely getting into the Animal Crossing trend, which is awesome. We see that all over social media now, which is great.
Everybody's doing that.
Which is great. So take us back to how you two met. What was it like when you guys started dating in dental school?
Yeah, so, getting into dental school is really difficult. So when we first started, everyone has that mentality, like, I want to crush all my classes, I want to ace all my exams. But then after a few exams, you realize that it's actually harder than you think. And so before we met, I was just studying on my own, but then it didn't really work out. So I started to join a study group. We had a few in our class, and that's where I met Casey. And we started studying. We went on lunch dates. During our free time, we'd all hang out with our friends, and it's just over time we developed something. And then we started dating in the winter of first year. And so our dates mainly were just study dates at coffee shops here and there. And like everyone else, D1s, D2s, you're stuck in lecture all day. We got sim lab, nonstop studying. And when you do have free time, everyone tries to go work out or they get some extra sleep. And so in the beginning, it was just a lot of juggling and experiencing this new environment together. That's how that's how the beginning was, right?
Yeah, because we had to stay like all time, all day. So we had more chance to talk each other, and we had more chance to, know each other better. So, yeah, that's how we met.
Mm-hmm.
Right, and that's awesome. Were there any immediate challenges that were presented to you guys while you were, dating each other while in school? I know it could be probably difficult, like you were saying with your difficult classes.
Yeah, so our GPA went for a roller coaster ride in the beginning. Like it's a stressful environment. It's really dental school is really demanding. You have a limited amount of time to get a lot of stuff done, and there's high expectations. And so we had to learn when we do study, we had to learn how to focus and actually be productive in our study time. And another challenge, I think, it was mainly another challenge was the anxiety that dental school brings about. You end up hyper focusing on future events like exams and competencies, and you start doing the what if I don't pass and what if this doesn't happen and this goes wrong. So that energy we would give and take with one another, and that kind of got stressful, and that would overflow into our our test scores or our competency results. So that was a challenge to learn how to take that negative energy and kind of learn to channel it somewhere else, not each other. Do you have anything now?
Yeah, I think that we fought a lot in the beginning, because in the beginning we didn't know each other really well. So, because, dental school setting, we get a lot of stress every day, you get depressions and everything. So because you're so stressed, you're so, sensitive to everything. So,
Take it out on each other sometimes, and it's we forget that the other person is also stressed out, but we end up relying on each other, and it's thin ice, around exam time it's really thin.
Right.
Few years to understand each other. So
yeah, so that's the immediate challenges, and then it got better throughout the years, as we're learning more about each other and learning how to handle this dental school thing.
Mm-hmm. Was there anything specific that you would do to help relieve the stress, like anything like exercise? I know a lot of people in our class, we like to, go out and have dinner with each other. After you finish a long exam week, everybody
Right.
goes out after, that sort of thing. Is there anything that you guys would do specifically?
Yeah, we would do that. We'd go out for dinner with our friends, and I like to cook, so I would always make meals and invite other students, our friends, and we would do that. We watch movies. We both really like golfing, so sometimes we just go out to the golf range, hit a few balls, or
Oh yeah.
go out to the course with some other friends. Enjoy beer along the way, have a good time, and some personal space too. Just need to be in our rooms, just watching YouTube or just taking a nap. That always helps.
Mm-hmm.
yeah,
Okay, cool.
we have privacy. So yeah, after exams, and we just went our house and had our own time.
Right. Are there any like specific study strategies that really kind of helped you guys, persevere when you're trying to persevere with your MBDE and that sort of thing, and then also with your regular exams and exam weeks?
Yeah, I made charts. Like I made charts for everything. I would color code my charts, and I would make charts on OneNote, and I would share it with my other classmates.
Mm-hmm.
And they said that it was helpful. It's hard to look at slide after slide, PowerPoint after PowerPoint. It all becomes a blur. But I found it easy to put everything into a condensed chart, group everything together so you can see it all at once.
Right. I mean, that definitely works for doing like bugs and drugs,
Mm-hmm.
Yeah.
And
I
then
love
in our study group, we would just take turns. There would be a certain topic, and one person would just like run through all the information, and then the next person would do the same. That's another tip, to make sure that you have all your stuff down packed, and sometimes hearing someone else explain it also helps.
Yeah, we always study separately, and then like 1 or 2 days before the exam, we
Come
got
together as a group.
Yeah, and then we
Right.
went up to others, and if there's something missing, then we let them know, and
Mm-hmm.
yeah, we work as a team.
Yeah, good way to test each other.
Hmm.
Yeah, I think that's a great strategy. After you've done your own self-study, then you regroup with other people, and I guess you can kind of see things from another perspective that can help you remember it, but also they might fill in the gaps, right, that you might have missed.
Right. Yeah.
Right. Not just coming together as, classmates and dental students working together, but coming together as partners, in life. You guys are married now and you're together. So I'm sure that definitely helps strengthen your bond over the years. Those times spent, problem solving together.
Right. Right. And then now we know like each other's style when it comes to problem solving, or you know, dental school definitely helped. We saw lots of different sides of each other.
Hmm. So what's one piece of advice that you would give to our students that are listening right now, and how to succeed during dental school? So like a piece of advice for a dental student that's about to start dental school.
That's about to start dental school.
Yeah.
So for me, I like to study on my own. In undergrad, I was able to get by that way. But when you enter dental school, it's a different setting. And so for someone that's starting, I would say things that worked for you up until this point might not work, but that doesn't mean that you failed or that technique is not effective anymore. You just have to learn to adapt. And it's stressful sometimes because you're not used to it. But when you might have to change some of your ways that didn't work out for you, ways that worked for you in the beginning might not. So just be open to that. And if other students are succeeding, just take a look and ask them what they're doing and kind of try to implement that.
Mm-hmm.
Mm-hmm.
Yeah, I think you're keeping your mentality positive when you're studying is very important. Getting dental school is very difficult, and you always have dream to get into dental school for a long time, and now you're studying at dental school. So, I mean, when you study and you think that you're studying, that's something that you always wanted to, right? So, if you think in that way, I think you'll be able to enjoy studying a bit more, even though you're stressed or tired physically or emotionally.
Yeah, try to enjoy studying. That's another tip.
Try and enjoy it. Yeah.
Try to enjoy
Right.
it. Just
Yeah.
trick your mind, trick
Yes,
your brain
that's
into
yeah.
thinking that this is the best thing.
Right. I really like how you guys are you're conveying for students to have a positive mental attitude, right? And just, try and keep the stress down. That's great. So to follow up with that, how about think back to when you were about to graduate, fourth year dental student, finishing up competencies. What's something that you could tell yourself back then, that last 2, 3, 4 months of dental school to prepare for working in the field of dentistry?
I mean, in that time period, We've been busy having interviews here and there. I think we had a lot of interviews in specifically Virginia. So yeah, I think we've been busy for preparing.
Can you repeat that question one more time?
Yeah. Just advice to yourself before you're gonna graduate. What's something that you would tell a dental student about to graduate?
You've worked this hard. You made it out of dental school. The next step is it's the same thing. It's dental school prepared you to graduate and to be a dentist, and you're about to do it. There's nothing to be scared of or nervous about. It's just you're gonna be fine.
Yeah,
just not to worry.
be confident.
Yeah.
Like as a new grad, once
Yeah.
you start working, you will make mistakes and you will be stressed at the work setting.
But the biggest tip though is those bosses that are interviewing you, they were also once a new grad, And so you're not alone. And so when you're about to graduate, just be confident. You've gone through dental school and you'll do just fine. And the dentists out there, they're going to be there to support you, and they all want you to grow. They were in your shoes once too. So that's what I would say.
Right. That's great. I mean, you bring up a great point. That's what a lot of students that are about to graduate are concerned about. They're like, I'm not going to be ready to start practicing. Like maybe, they're like, oh, I've only done like a couple crowns. I don't feel comfortable. So, I mean, that's good that, to say just feel you'll be okay. That's a good message.
Right. And I think it's important. It's awesome that you talked about, you've now graduated dental school, own it, you've spent that time. So now let's pivot a little bit. Let's go from you've now graduated, you have that confidence, and now you said earlier the two of you work together. So, what's the dynamic in the office like, working together?
I mean, we work in Virginia. We work in the group practice. We have 6 different offices. We have 15 general dentists, 2 pedo doctors, 2 orthodontists. So
it's a big
yeah, we work with a lot of dentists, and then because we have 6 different offices, we only see each other probably once a week. But when we work together, we try to keep our conversation to minimum. We just try to talk about patient cases and to get the second opinions and stuff like that. Try to work separately as much as possible. Try to focus on our team, our patients, and cases and stuff like that.
Yeah, so when we're working together, we found that it's really important to give each other space, because we all have we both have our separate teams, our team of assistants, and we need to do team bonding and team building. And if we stick together, we're not able to do that. And then at work, we have to type up notes, we have to review cases for the week, and sometimes we might have a really difficult patient, and then we just need some space to de-stress in order to get ourselves mentally prepared for the next patient. And so we try to keep interactions to a minimum, only if it's really needed.
Okay.
That's good.
Mm-hmm.
And so you think that's kind of helpful. Do you guys talk about, so you don't talk about any dentistry stuff when you're at home, or what's that like?
Oh no.
Yeah,
that was our big challenge.
We used to talk about dentistry after work, but now we made a rule. We don't talk anything about dentistry after dinner time, because we realized it's not healthy for a relationship.
Right.
Yeah, we would bring work home and talk about work over dinner, dentistry over dinner. After dinner was done, we talk about work and dentistry, and it's like the work never stopped. Yeah. So that's something that we've been working on.
Mm-hmm.
Right. Well, that's nice. It seems like you guys found a nice, healthy balance of what works for you. You spend all day working together, and then, you're still together when you go home. So it's nice to then be able to go home and kind of de-stress. So I think that would definitely be what attribute you all to your own individual success, which is great.
Mm-hmm.
Awesome. So you mentioned it was 6 practices and 15 general dentists?
Yeah.
Wow,
and 2 orthodontists and 2 orthodontists. We have a full team. Yeah.
That's awesome. Like, that's something that we really aspire to be. So can you give me a little bit more information about your practices, how many people work in there, just kind of the dynamics, like clinical procedures, all that sort of thing?
Yeah. So when we first graduated, this was the kind of setting we were looking for. Because we didn't do a GPR or a AEGD, we thought, let's find a practice where there's multiple dentists, where we can have that mentorship. And because there were 15 dentists here, we have plenty of that. And all the senior doctors, they want to mentor, they want to help you out. And so we're in a pretty healthy, safe working environment. In the beginning, we would have a lot of questions about certain patients, certain cases, and a lot of them, they would just jump in the clinic room and talk to the patient together, and we would treatment plan together, and there was no problems. We didn't have any issues when it came to that. when we had any trouble reading an x-ray or finding a canal during a root canal procedure, no problem. One of our senior dentists would just hop in and do it with us. And then whenever we get backed up, because there are so many dentists and dental assistants, we share assistance with one another. If we get behind and the hygiene checks and the hygienist get backed up, another dentist will jump in and get the checks. And we always check up on each other, make sure everyone's done before we go out to lunch or before we go home. So it's a good environment to be in.
It's a good dental setting. We work as a really good big team, and then we help each other. We still discuss about cases every month. We still I still ask for help. I still get the help from senior dentists when I have problems like root canals and extraction. I still ask help, and so I think it's a really
it's
important,
a good environment
to find some senior doctors who can give you some mentorships and helps and stuff like that as a new grad.
Yeah, that's a number one thing to look for when you're interviewing for jobs.
Right. I think that's awesome. You guys sound like you've got some great culture in your practice. What are some other things that you might attribute that good practice culture to? Would you say it's just mostly the leadership, or do you guys do like some specific little things like team building things, anything like that really helps the culture in your practice?
Yeah, so we try to have doctor meetings because there's so many dentists and we're all rotating. We might not see certain dentists, and one office might have a problem, and that problem might occur in another office. But in order to communicate well, we try to have monthly meetings, probably every quarter, and that helps keep all the doctors on the same page and address any problems that we have, and that helps prevent any problems from occurring. And I think it's leadership, teamwork, communication. Those are the top three things that pop in my mind.
Yeah.
Okay, so can you guys tell me what are some things that you're individually interested in the field of dentistry? Is either one of you trying to really focus on implants, or are you trying to go into a specific direction?
Personally, I like to do the root canals and extractions. I like challenges. So when you find difficult canals and finally see at the final PA, you feel great. So I like doing root canals and extractions too. All the extractions, a lot of extractions are difficult. So when you have that tooth out, and you feel great too. So
yeah, it feels good if you feels
Right.
good to look at a good root canal and to take out a tooth that's difficult.
Yeah.
Feel satisfaction in that. And I like to do crown and bridge. I've been having more anterior cases and more cosmetic cases, and that's kind of getting me more interested in dental photography. And we both want to start taking some CEs for implant placements in the near future. We figured that in the first first couple of years outside of school, we just wanted to get our speed up, just make good habits and be more comfortable before we started investing in ourselves and before we started to do more like those expensive CE courses and implant placements.
Surgeries.
Yeah. So that's how we have been trying to grow. And there's always new technology out there in dentistry. There's always new materials, new equipment. And that's always interesting. And right now in our office, we don't have the fancy like CRAC machine, and that's something that we are looking forward to having. And more dental photography. Definitely want to get into that.
Right. So are there any specific CEs for dental photography, or maybe even like you're saying you're interested in endo, any specific CEs that you like and any that you have taken that you would recommend?
Yeah, for dental photography, honestly, right now, just in this time, I've been just looking at different Instagram accounts, and a lot of the dentists are doing some live sessions and collaborating with other dentists. And I've just been just watching those. We haven't done any hands-on CE courses yet. Just like we said, we still have so much to learn from our senior doctors at our offices. We're not jumping into that yet, but definitely in the near future, we want to be taking some hands-on endodontic courses and like surgical extraction and implant. Those are the top three we want to jump into.
Mm-hmm. Okay. Any so have you purchased a DSLR? Are you using that right now?
No, we don't have any equipment yet.
Okay. Well, I went to a Dawson course a month ago or so, and it was covering occlusion, dental photography, and implants. And they gave us like a printout with the exact settings that they take all their photos with on the DSLR. So I'd be happy to share that with you.
Oh, yeah, definitely.
Yeah.
That'd be great.
Yeah, that was a good course over there in St. Pete in Florida. Yeah, the Dawson course. So.
Yeah, we were actually looking at the Dawson Academy too, because there's one in our area in Southern Virginia.
Yeah, we've been looking at.
Yeah, we're thinking about doing it once our normal life gets back, once our normal routine comes back.
Right.
Okay. So going back to both of you in your career, you dated in school, you're currently married now, you work together. So take it back to, let's apply it to some of our listeners. So would you recommend that another dental student date, someone in their class? Or, let's kind of go into the pros and cons of that. Would you recommend it if you had to do it all over again? Or would it be something that you'd maybe, think of maybe doing something else?
It's different for every person, but I think having Casey in dental school helped me get through it. Like a pro to dating another student would be, because you guys are both in it together, you understand the pressure of dental school. And so when you complain or vent, or you have a better chance of the other person really understanding and accepting that. Whereas if your significant other was outside of dental school, they might just think that you're complaining. They don't understand the pressure, and it might frustrate them, and it might frustrate you. That's one. You want to share another one?
Yeah. I think for the con. Yeah, I think it's very important not to spend too much time together. You need sometimes your privacy. That's for the relationship. And if you break up in dental school,
it'll be awkward.
Yeah, it will be awkward. So you need to find someone really.
So that's a big con there.
Yeah.
Yeah. Okay.
Yeah. And then another good thing is, you guys can spend time with each other, even though it's going to be a lot of studying. If your significant other was outside, you have to wait until like holidays or school breaks to see each other, and that can be challenging. And if you ever have any problems, and your significant other was outside, you would have to resolve problems over the phone, and that could be really stressful, especially if it's during like an exam week when you're already stressed out. Like waiting for a phone call could, just give you more anxiety on top of everything.
Right. So it's great. It sounds like you both have really made such a beautiful relationship and beautiful partnership out of getting together. And one big piece was that you grew together in dental school, which is beautiful. So, from your perspective, what advice would you give to a couple that has decided to start dating in dental school that's going to embark on this relationship together, while going through dental school? What's some great advice you could give them?
Yeah. And advice is, there's always time for a significant other. There's always time for dating. It just depends on you prioritizing things, on your balancing skills. So my advice is there's always time. And when you are in a relationship, to try and communicate and share the journey with your significant other, so that they can understand you better. and just be aware of how you channel your stress and your anxiety to your partner. And I think that's another big advice. Being aware of how you're channeling your negativity, because there's a lot of that in dental school. And another advice is try to do new things outside of dentistry, because you might bore the other person if you just talk about school. Yeah, and that's what happened to us. All we talked about was school and dentistry, and we realized we need a branch out. Yeah.
Awesome. Love it. So let's look towards the future now. So, we got COVID-19 going on, and like you guys said, hopefully we will be moving past this soon. What are some of your plans for the future? What are you guys looking to do? And where do you kind of, see yourself in 5-10 years? What are your hopes and dreams?
Yeah, well, just one is, we're finishing up our second year of working now, and so we think it's a good time for us to, do a Dawson Academy or go to Pankey Institute, just to invest in ourselves. We haven't done that yet, so that's just a small goal in the near future. Maybe 5 years from now, hopefully we're opening up our own practice. That's something that we want to do. And 10 years from now, maybe it'll be 2 offices.
Yeah.
One for Dr. Min and one for me.
There you go. Awesome. Love it.
That's been awesome. Thank you guys so much for joining us today and sharing a little bit about your journey. We love hearing that you grew together through dental school and that you've been able to, partner it into this beautiful relationship that you have working together. That you have dreams and goals and aspirations, and that you can link your life with dentistry and link it to your life outside of dentistry, but still at the same time keep them in their own realm, which is awesome.
Thank you. We're trying. It takes work.
All right, Dr. Min, Dr. O, thank you guys so much, and it's been great talking to you.
Thank you guys.
Thank you very
Thank you
much.
for inviting us.
All right, Vibe Tribe. We hope you enjoyed this interview with Dr. O and Dr. Min. This couple is killing the game in dentistry. They found love, they found success, and now they're just working on building their empire. So let's all try to emulate that, and we'll keep moving, and we'll become successful ourselves. So, as always, give us a like, give us a follow, give us your feedback. We love to hear it from you guys. We want to make this better. And as always, remember, follow us on Instagram at dental.student.vibes, and always stay posted for some more content.